Right, so I'm going to do a brief summary of PTSD and a little bit of a link to burn survivors. So PTSD, post-traumatic stress disorder, is an anxiety disorder which may develop after very stressful, frightening, or distressing events. My early understanding of PTSD was that association with soldiers after they've returned from war. And this could be because there's been various names of PTSD that have come from war, so things like shell shock, war neuroses, post-Vietnam syndrome. And that post-Vietnam syndrome was increasingly diagnosed in veterans in the 70s. And that ultimately led to the adoption of PTSD as a diagnostic category in 1980 in the third edition of the Diagnostic Statistic Manual of Mental Disorders. So PTSD doesn't only come from sort of war and conflict, but it can also come from serious life-threatening accidents, so such as burns. It can come from assault, whether that's physical, sexual assault, abuse, childhood, domestic, or trauma related to a sort of serious health problem. So some of the symptoms develop during the first month of a traumatic event, but some, similar to burns, there's a bit of a delay, so it could be months or even years before these symptoms set in. So one of the big ones that most people are probably familiar with is that re-experiencing of that traumatic event, through flashbacks, dreams, nightmares. So it might not only be a flashback, but they could also experience those physiological symptoms as well, sort of pain, sweating, feeling sick, trembling. You can also have things like negative self-perception, so feeling defeated, worthless. Could have problems in relationships. Could be a bit of a disconnect between yourself and the world around you. Could have lack the ability to experience certain feelings. You feel detached from other people, give up on activities that you once enjoyed, communicate less with other people, have negative thoughts and feelings about yourself. You could engage in self-destructive or reckless behavior, and then there'd definitely be an avoidance of any situations that would trigger that specific memory. So for things like burns, it could be candles, open fires, and things like that. So if you think burn survivor, the burn injury can be a very traumatic experience. So the psychological response from not only the injury, but from what you've witnessed or experienced, say if that was a house fire, for example, very, very traumatic. Not only that, you've then got the treatment of the burn injury. So not only the burn itself is painful, but it's also going to be painful surgeries potentially, wound dressings, and then any therapy that's potentially needed after that. So any physio or occupational therapy. Progressing from that, you could also have alterations in your own body appearance, and depending on where that is on your body, whether it's face, arms, legs, could have an impact on that PTSD as well. So survival rates for patients of burns have increased over the years with medical advancements. So very much a focus on biomedical and not so much on the biopsychosocial. So how do we address patients that have been an injury of burns, their emotional pain, and any emotional needs that they need. So there was a review by Van Lowy and Van Son that reported that 90% of burn patients would experience some form of stress. So acute stress disorder lasts between 2 days and 4 weeks and would occur within 4 weeks of that injury. And PTSD says 3 to 58%, so quite a big range, would then develop PTSD. And that would usually occur 3 to 6 months after the burn, or even up to a year after that. So some of the risk factors, we've got gender. So both males and females are affected. However, there's a higher incidence of females. And this could be things from interpersonal violence, which would then cause disfigurement. As just one example. We've got other factors such as whether the accident was a result of yourself or somebody else that caused the accident. How well you've previously coped with stressful situations. Younger age groups seem to have a bit of an increased risk of PTSD, and that could be because they've not had enough time to develop coping strategies, just as one example. And then people from a low socioeconomic status. So some of the treatment, obviously there's medication that can help, and then things like cognitive behavioural therapy, processing therapy, prolonged exposure, narrative therapy. So anything that's teaching an individual to gradually approach that trauma-related memory and learning how to challenge unhelpful beliefs related to the trauma. So just a little whistle-stop tour of PTSD and burns.